So part of rehab for sports hernias as well is proprioceptive training. And I know it's a large word, but it basically means, do you know where your body's at in space? Or generally speaking, you can almost use the word balance to describe it as well. So in this video, I'll give you some examples of some exercises we use in the office here to rehab people through proprioceptive training. So one of the ones we like to use is a star lunge, or think of it like you're moving around the clock. So this is going to be the leg that's being worked, and we're just going to go to the portions of a clock all the way around. And what we're trying to do is create almost, again, balance. And the reason why I'm using the quotations is because balance is not the exact term, but it's one you're going to understand very well, is we want to make sure that the knee's not caving, that the foot's very stable, that the trunk isn't moving around. Because with sports hernias, one of the important parts is, does the hip function well? Does the trunk function well? And are we saving all the muscles, tendons, and fascia going to this junction right here? Okay, so we typically do the other side, coming back to center every time. Woo, I'm falling around too. Okay, another example is med ball tosses. And this is not a med ball we can use against the wall. So we usually go into a split stance, and you can imagine me just tossing it across and tossing it back. And the wall can be very close, and basically we're looking to see if this knee wobbles around a lot, or if they're falling over, and that does happen quite a bit. Something else you can actually use is just tossing something back and forth, because the weight of the object is throwing me off balance slightly, and even the throwing aspect is throwing me off balance enough to where I have to control all this right here and feel where my body's going in space. So can I control it through motion? Last one is a step up and hold. You can use something like a med ball or a sandbag. You don't have to. We'll use it stepping up. So this is the movement, and you want to make sure that you can hold the position. Okay, you can move this through it if you want to. You can throw it at somebody. You can have someone throw it back at you. But the point is driving through the motion and holding the position. Again, proprioception. Can you figure out where your body's at in space? And this will help out your muscles, tendons, fascias going through that junction of where sports hernias happen much, much better. They will protect them and make them work much better. Now, if you have more questions on sports hernias, we do have a course that we put online to basically show you the stuff that we do in the office here to take care of patients with sports hernias. Now, remember, this is a disclaimer on this, is we're not showing you how to do this so you can do it all on your own, because sports hernia rehab is really, really tricky. Sometimes you do actually have to have a surgical procedure to correct it, but in the early stages, a lot of times these can be caught and rehabbed pretty well. So make sure you see your doctor first, but check out that course. It'll help you out a lot in realizing what sports hernia management's about.